So the problem of relationship between allergy and allergic diseases and cardiovascular risk has been of interest to epidemiology and cardiovascular scientists for many years, yielding very controversial results. However, when we look at the bulk of evidence that we have now, I think we can quite convincingly conclude that in majority of patients the risk of cardiovascular disease is increased. It is different in different allergic diseases. So for example, increases related to asthma, especially allergic asthma, are much greater than increases of cardiovascular risk, for example, in allergic rhinitis. However, large studies, for example, in nuns population in the United States, are showing that about 20 to 30% increase of risk of cardiovascular, of coronary artery disease and cardiovascular events in patients with allergic rhinitis. And this is important because allergic rhinitis is a very early occurrence in the life of our patients. In people between 20 and 30, it actually affects about 60% of our population. Our lab in both Edinburgh and in Krakow is focused on trying to understand this link a little bit better. And I must say that we started our work from the opposite angle. We believed and we thought that actually allergy patients maybe will be protected from cardiovascular disease because histamine is known to induce nitric oxide synthase and nitric oxide synthase activation with nitric oxide release, dilation of blood vessels. So everything that's good about the vessel wall is actually induced to some extent by histamine. But at the same time, it turns out histamine as well as cytokines, which are pro-allergic, are activating number of different pathogenic effects. So in our studies, we see very clearly that firstly, allergic patients in the peak of allergic season show features of endothelial dysfunction characterized by loss of nitric oxide bioavailability. Secondly, in models of allergic inflammation, for example in mice, we can see that induction of allergic inflammatory response results in not only impairment of ability of blood vessels to relax and release nitric oxide, but they become more oxidated. It turns out that these vessels start producing free radicals, particularly superoxide anion, by upregulation of enzymes such as NOX1 and ADPH oxidase 1 within the smooth muscle cell and endothelium. And this results in the most classical mechanism of endothelial dysfunction that precedes development of atherosclerosis. And I think these kind of events are very important when we take into account our allergic patients. In the peak season, they experience these bouts of endothelial dysfunction throughout their life, especially in young age, at this early stage when atherosclerosis actually starts to develop. That's why I think intensive treatment of allergy is very important for our patients, not only for improving their actual quality of life at the moment, but also for preventing cardiovascular events in the future.